My next guest is Dr Vivek Eranki from Cosmetique Clinics. Vivek, how are you this afternoon?
Very good, thanks, Richard. Great to be back. How are you going?
Very good, thanks. Good to talk to you again. Your role in the business, because it is Father's Day and we're talking about, males on this day. How did you manage to grow the business while being a dad?
Yeah, so I started this business back in 2017, and previous to that, I've been running businesses for the last 10 years. So we've had businesses in the space of occupational health, allied health, GP specialist suites, as well as licensed day hospitals. So I've got a fair bit of experience running businesses. But as I age in the last 10 years, the number of members of my family have gone up as well, which then poses new challenges as well as new chapters on how to balance both, your business, your work, as well as family. So I've got 2 boys, and I've got a third on the way due in November.
Congratulations.
Thank you.
That's it. So it is a work-life balance sometimes for so many people out there, isn't it, Vivek?
That's correct. Over the years, I've sort of looked at it more as a work-life harmony, because a balance sort of implies that you have to forego one for the other. But for both of them to coexist, it is really a harmonious relationship between work and life, and that's what I found. And what is essentially a scarce resource is actually time. And what happens is, as more and more things pile on, you basically find ways to maximize the time that you spend with the family, the time that you spend at work, and you really prioritize things that give you happiness, essentially, at the end of the day.
And, you're the founder of Cosmetic Beauty Clinics, which it's the largest chain of injectables. Just describe to me what an injectable is.
Yeah, so injectable clinics or beauty clinics are clinics that specialize in essentially the aesthetics of patients. So what we predominantly do is we use Botox and fillers to improve patients' aesthetics, but more than Botox and fillers, we also use things such as lasers for laser hair removal. We have various dermatological treatments such as peels and skin needling, for example, and IPL facial. So our predominant focus here is on the aesthetics of a patient in order to make them feel better. But where we focused on in the business is really the safety aspect of it. So we essentially focus just on treatments with the highest safety record, rather than providing a vast variety of treatments, which some of them may or may not work. And the reason we were able to focus on this is because a happy patient is a patient that gets the results. And that's essentially what our mantra was from the get-go.
And, we get so many people going down this path, don't we, now, compared to, let's go back, say, 10 years ago, because, you're qualified in what you do, but, we've seen the whole industry change, haven't we?
That is correct. So 10 years ago, when I was still working as a clinician, so I retired clinically in 2021, so about 2 years ago, is when I retired and I transitioned full-time into directorial and executive roles. But 10 years ago, what was happening is significantly different to what is happening now. And the main shift comes from how people perceive injectable treatments. So I remember 10 years ago, or even about 6 years ago, 5 years ago, when patients were coming in, they didn't want anyone else to know that they were having treatments done. So they used to schedule it in for the weekend. They used to schedule it in when their partners were away in fly and fly out work, and they used to pay in cash, so it doesn't reflect on any receipt. Now, from what I understand from our clinical team, patients are coming in wanting to live stream the whole experience. So they not only do they want to, the aesthetic that they're going for is something where they want people to know that they've had treatment done. No, they want the entire world to watch them have the treatment done, which is a unique perspective on this, which, thankfully, I've never had to deal with back in the day. And I consider this to be a proliferation of social media,
Yes.
which, circling back to Father's Day is something that I'm very cognizant of, especially, having young kids and the effect of technology on kids nowadays.
And, it's the number one question I've got, does it hurt?
It in some cases, you can have a little bit of discomfort, but again, what we do is very minimally invasive. So we use things such as nerve blocks, or we use numbing agents in order for it to be as comfortable as possible. But if you think about the size of the needle, we use a 0.3 mil syringe with a tiny little needle. So most people describe it as a mosquito bite. So pain isn't really an issue with patients with the kind of treatments that we're doing. Now, this is completely different from the more invasive treatments such as surgery, where pain definitely is an issue, and then patients have to factor in a significant amount of downtime. Whereas with injectable treatments, most patients get back to work within a few minutes. They put on their makeup so that they can conceal any bruising that could happen, and even the bruising itself lasts maximum a few days.
And Botox can be used for various things now, can't it? So medical conditions that you have. Correct me if I'm wrong.
That is exactly correct. So Botox itself has a variety of uses. So we predominantly use it on the aesthetic side, but then there are neurologists, for example, who use it for migraines. Dermatologists use it for hyperhidrosis in order to stop people from sweating. For example, obstetricians gynecologists could use it for cervical dystonia. Urologists use it for bladder spasm. So what Botox effectively does is it stops a muscle from acting. That's all it does. And whichever specialist needs that action to be done, they can use Botox effectively. Botox, funnily enough, was actually discovered by a ophthalmologist in order to help people with strabismus or being cross-eyed.
Wow, there we go. That's amazing stat. Wrinkle relaxers, just what does that actually do?
Yeah, wrinkle relaxers are a generic term for Botox. So that is the mode of action. So Panadol being a pain relief medication. So the way it works is a lot of the facial muscles they attach into the several fascias of the face itself. So what basically happens is when our nurses and our doctors inject the appropriate area in the face, it causes that muscle to become less active, thereby relaxing the muscle so that it doesn't form dynamic wrinkles. And hence it's called wrinkle relaxers, predominantly because it is being used in the aesthetic space. Another common agent that we use is called dermal fillers or hyaluronic acid fillers. And these are fillers that we inject into where patients have a volume deficit or an area where patients want to increase their volumes there, for example, their cheeks or their lips. And these agents themselves are natural to the body, so they degrade naturally with time. In some, depends on which one you go for, they may last anywhere from 3-6 months to even up to 18 months.
Okay. Now, laser hair removal, for so many people out there is very popular. How long does it last?
Yeah, so laser hair removal, nothing is permanent, so it doesn't cause permanent loss of hair, but it does cause permanent reduction in the amount of hair. Because what you're effectively doing is you are adding injury to the hair follicle, and hence some of them will die with time. Most of the time after 6 cycles, patients don't need to come back on an ongoing basis, but it also depends on how much hair patients have, as well as their hormonal status as well. So hormones play a big role in how much hair somebody has. But most patients typically find a good result after 6 treatments. In the olden days, laser hair removal used to be quite painful and quite expensive. So at Cosmetique, we do hair removal from $6. And on top of that, we have a 10% price beat guarantee as well. And we use a machine that is called a diode laser. So this works across multiple skin tones as well, because we are aware of the fact that we are a multicultural country. So we have patients with very pale skin to patients with a very dark skin as well.
So yes, when you go in to, get a quote about, all of this, can you just, make a booking and come in and have that discussion with them?
Yeah, absolutely. So what we do is patients book in for a consultation. There is no obligation for anyone to have a treatment. So they have a consultation with a nurse and a prescribing practitioner, and we are able to provide them a quote, and patients can go ahead with the treatment whenever they want, really. So, there is no obligation at all. Our nurses are very happy to have a lengthy conversation with the patient so they understand exactly what the treatment entails.
I mean, that is excellent. Where can we find out more about you?
Absolutely. So, Cosmetique itself has a very good website with all the information on there. So, cosmetique.au is our website. Again, patients can give us a call anytime they have any questions at all.
Vivek, it's been great to talk to you again. Sorry, we just had phone troubles, line 2. So, where can we find out more about you?
It would be the clinic's website and the clinic's Instagram, which is cosmetique.au, and our phone number is 1300 320 272.
That's great. Vivek, have a good afternoon, have a good Father's Day, and we'll talk to you again soon.
Thank you, Richard. Have a great afternoon.
Thank you.